Cancer Guidance by Type, Part 40. Dr. Dilip Gadgil, Pune. Leukemia. When the patient was diagnosed with autoimmune hepatitis, the bilirubin had reached 36. There was nothing that allopathy doctors could do, so they sought my advice. It was evident that his condition was bad. I gave him medicines, but he died in 2 to 3 days. What is surprising is that the doctor that I was talking to believed that the bone marrow transplant was successful and blast cells had come down to 0. However, I didn't understand how they could call the treatment successful if the patient had died despite all these results. Unfortunately, doctors are proud of these things. According to me, how long and how well the patient has lived are better indicators of the efficacy of the treatment. There was an 8-year-old girl from some remote village like Osmanabad or Bede. Along with chemotherapy, we were giving her medicines which we continued even after the chemotherapy. Her cancer didn't relapse after that. She is now 15 to 16 years old. If Ayurvedic treatment is done parallelly and the diet is taken care of, the immune system can be fortified, thus avoiding the chances of relapse. The immune system is affected by chemotherapy and hence, a diet of milk and rice, or at least 1.5 liters of milk every day, is necessary for it to recover. There is another type of cancer called CML, chronic myeloid leukemia, which is comparatively less troublesome. If the WBC count is over the limit, it can be controlled with the help of medicines. However, these medicines have side effects. If Ayurvedic treatment is done parallelly, it is possible to achieve positive results. Simply relying on chemotherapy and bone marrow transplant isn't the answer. Consuming natural food, drinking indigenous cow milk, following a healthy lifestyle, and taking Ayurvedic medicines can help the patients get better. There was a little girl whose case had come to me from Kerala. She was already undergoing treatment and feeling better. I felt that there was no need for me to meddle or ask the patient to change their course of treatment. Her blast cells had reduced and she was being given only Ayurvedic treatment. I told them to continue the ongoing treatment while her doctor and I monitored her progress together. This case is a good example of the fact that cancer could be treated without using chemotherapy and solely relying on Ayurveda.